interstitial cystitis is an element that we will be talking about because here in the United States it is considered to be non-curable, while indeed there are ways to take care of it, and those ways that we do in Europe. So what is exactly the stress urinary incontinence? Well, it is very elusive, and it really depends on the point of view of the person. If the person is a strong individual and has a goal, has dreams, then urinary incontinence is more of a nuisance that they live with and they move on. Those people that are of weaker mental constitution, then this is becoming a problem, leading very often to depression or very heavy depression, very deep depression. Stress incontinence is divided into three types, depending on severity. There is a fourth type called intrinsic sphincter deficiency that is indeed probably the most severe way or most severe form of stress incontinence, which would make it type 4. Nevertheless, that is classified separately. Another one is urge incontinence that may or may not have neurological component to it, and mixed incontinence, obviously, combination of all those above. There is another type of incontinence called overflow incontinence, and depending on the point of view, I would rather classify it as retention, as urinary retention. The incontinence manuals treat it as incontinence, while in fact what happens is that when people are retentive, they cannot empty their bladders completely. Those bladders are filling very, very quickly, and patients with this condition are basically dripping urine all over all the time, so that's why it is called overflow incontinence. Now, all this said, you see the last item on the slide, arbitrariness of definition. Once again, it is a perception of the examining physician, perception of the patient, perception of the family of the patient. So a lot of this depends on individual point of view. To continue with the next slide, here is the definition that I put in completely, in its entirety on the screen, so those of you that are watching it probably will have a better and more academic understanding of it. That it is stress urinary incontinence is a dysfunction where a patient loses the ability to hold urine. Every time straining of the abdomen occurs, when a person laughs, sneezes, coughing, lifts something, gets up, or squatting, or anything like. In this situation, there is usually a strong correlation between the stress urinary incontinence and the patient's physical condition. It's very important. The poorer the physical condition of the patient, the more prevailing is the incontinence. So people that are fit function better and have less of episodes of urinary incontinence than those that are not fit. Those couch potatoes is the very typical heavy incontinence patient. Obviously, there are many other circumstances that influence the propensity and the extent of stress incontinence. A patient with neurological condition, for example, general motor abilities, hormonal insufficiencies, and possible obesity, or for that matter, slenderness, are also quite influential and can be visible in those patients.
Is that because, Dr. Kulisz, the musculature around the bladder is lax? I mean, why would a slender person have a problem like that?
Well, the slender individuals, particularly young women that are heavily exercising, those women that want to have zero fat or very low percentage of fat, they are losing the fat, quote-unquote, cushion around the bladder neck. And the bladder neck is losing its mechanical support, and very often in those women, this bladder neck doesn't close completely. And this is the first dam, if I could put it this way. The second one is sphincter. So if the bladder neck doesn't close very well, then or it's actually less, it's losing this support, then it's much easier for urine to penetrate to the structure of the urethra and leak out. Once they get a little fat, then this goes away.
Okay.
I mean, we've seen it in England, particularly among British population. There was the time of very young women that wanted to look like Diana, Princess Diana, and many of them really wanted to be that way, and they were overdoing it, and we've seen it in the Bristol Urological Institute quite a bit of this. So just a footnote, this is temporary and usually goes away as soon as they get some fat around. Okay? Okay, so let's talk about, did I answer the question?
Yes, yes you did, thank you.
Okay, type 1 is usually an early stage. This is when occasionally when we have attack of cough or in the company of somebody that says great jokes, we start laughing, and then sometimes we drop 1 or 2 drops of urine. It's not a big deal. We need to just watch it and be sure that this is not going to go any farther. It is an indicator that sphincter is unable to hold the urine well enough, and the bladder pressures exceed the abilities of sphincter to control it. Once again, it's not a big deal. Improve physical condition, everything will be just fine. It's nothing to be alerted about. When it comes to type 2, any straining activity may cause urine leak. So this is really something that person has to watch, and person has to do whatever she can, mostly she, to improve her physical condition, and once again, this is going to go away. It's not a big problem. I'm a great proponent of non-surgical, non-medication ways to do it, and every one of us, or every woman for that matter, that has very little of desire even can do it very easily. This is not a problem. When it comes to type 3, this is the most advanced of those 3 types, and it's continuous leakage. And any minor effort, any minor change of position, getting up from the chair or trying to, say, bend over, sitting in a chair to get, say, remote control for a television set, this is causing a leak. Not to say, I mean, of course, any coughing, sneezing, or anything like it will do this too. And those people are completely dependent on pads or diapers, and they're very often very depressed and very lonely. This is a very important element because they are not, I mean, obviously they are not very social. It's very difficult to be social in such a case. And very often they separate themselves from the rest, even from their own closest family. So this is something to be really addressed. When it comes to intrinsic sphincter deficiency, this is the most severe form of urinary incontinence. So once again, I would consider it type 4 if there was such a thing. People basically don't have bladders anymore. I mean, anatomically, the bladder is still there, but because urine is dripping through it, the bladder doesn't have any capacity, it doesn't have any function of storing the urine, so it's becoming very, very small, and actually is that there is no storage in it at all of any kind. Now, some of those people are going through surgical procedures that repair or improve the closure of the urethra. In this particular case, right after the corrective surgery, the patients are experiencing very frequent voiding every, say, 20 to 40 minutes or 30 to 40 minutes. This condition goes away as soon as the bladder gets stretched and gets to its natural volume, which is, depending on a person and the physical constitution, somewhere between about 400 milliliters all the way maybe even to 800 milliliters, depending how large the person is. So those are basically the things. So this is about stress incontinence. When it comes to urge incontinence, and I'm not quite sure if I pronounced it well, I would probably need to ask Sherry because she's the one that speaks English here. Urge incontinence is it is something very unusual because you cannot predict it very well. It is instant onset of an overwhelming urge to void. And normally, individuals affected with this kind of incontinence never have enough time to reach the bathroom quickly. This is very frustrating and very interrupting to normal functioning. Like patients with stress urinary incontinence, those that have urge incontinence also use diapers as preventive measure. This is the only way to handle it, for that matter. Now, there is a very specific type of urge incontinence that some urologists or neurourologists are referring to, which is door or key incontinence, which is basically somebody coming to the door, putting key in a lock, and peeing at the same time. This is literally a trigger for urge incontinence. So this is something that happens very often to people that have urge incontinence. There are basically two reasons for this condition. The one is involuntary bladder contractions. It is caused by the truth or instability, but it always involves some form of a trigger, be it the key in the hole, something that we need to do before we get to the bathroom, or sometimes something that is non-physical at all, a sound of running water or anything like it. And then